today's webinar session on the pricing transparency final rule delay and how to respond. We've learned some recent news here just in the past few days that we're going to share with you and provide an update on. This is a 30-minute session, and I still do see some people dialing in. So we'll give everybody another minute or so to get settled, and then we'll go ahead and get started. All right, we're going to go ahead and get started with today's session. Thank you again, everyone, for joining us today. I'm going to start off with some brief introductions. I am Brad Josephson. I'm the Director of Marketing here at PMMC. I'm joined today by Greg Kay, who's the Senior Vice President of Revenue Strategy at PMMC, along with Tara Bogart, who is also Vice President of Revenue Strategy. Greg is going to go ahead and get started with today's presentation with some updates from CMS. So take it away, Greg.
Great, thanks, Brad. So we thought we would start with the news and the immediate response after the release of the final 2020 OPPS rules without pricing transparency requirement. So the initial reaction, just using this example from Becker's, where they provided an outline of the top things to know, and basically nearly everything moved forward from the comment period to final as initially outlined. The 340B reduction was an area that many hospitals raised concern about in the comment period, and it remained. The site neutral payment rule was also an issue that CMS had also lost an initial lawsuit, and it's working through the appeal process now, and it remained in the final rule. And the final release did not address, as we know, the pricing transparency rules for healthcare providers. If we look at another source, Axios, which is more politically focused, they led with the headline, "Hospitals Dodged the Bullet," and it highlighted the fact that the Trump administration had the inability to get things done. If we looked at another article from Healthcare Dive, they provided a more insightful article that headline things had been put on ice. And as Tara noted on last week's webinar, ice is a preservative, and it does eventually thaw. And if we look at the Becker's ASC issue, the ambulatory surge center issue that they focus on, it had an article that highlighted the fact that states such as Florida are still moving forward with specific pricing transparency initiatives. And Florida's launching an updated version to their statewide price comparison tool and are increasing the number of comparative services. Now, Florida is also incorporating a recognition award to those providers that are leading the way with proactive pricing transparency measures. So it's important to remember that this is an industry issue that is still moving forward on various levels. Even though CMS did hold on the release of the final rules, things are still continuing to move forward. Now, looking at more current news and really kind of taking a breather in the reality of the situation today, Modern Healthcare published a story this past Friday where Joe Gorgan, the White House domestic policy chief, shared their expectation for publishing updated proposed rules before year end. And he told reporters that they hoped to really have another announcement this month, maybe in December, but hoping it would be this month. Joe also added that the coming announcement is going to gore a lot of oxen. Now, I'm not real sure what he's actually referring to or who he's actually referring to, but it does appear that they're looking to continue moving this forward and not really backing down or having a significant delay with the release. Now, on Monday, RevCycle Intelligence published a more optimistic piece where several industry-oriented attorneys and consultants were interviewed after speaking at a recent value-based care summit, and they expressed their hope that the volume of comments around our industry's concerns would cause CMS to, if you will, kick the can down the road because they just can't deal with it right now. The article did highlight the fact that the final OPPS rules, kind of deep buried into the rules, CMS did state that the final version of hospital pricing transparency requirements would be in a forthcoming final rule. It's also important to take note that Seema Verma's recent tweet communication, this was back on November 1st, the day the final OPPS rules without pricing transparency was released. She noted that CMS is taking the time to review the additional 1,400 stakeholder comments that came in late in the comment period, and that they are considering the ideas to be very thoughtful and very innovative. So it's important to also highlight, the reference in her tweet that they're looking to finalize the pricing transparency rules for hospitals alongside a comprehensive proposal for health plan pricing transparency. So it's reasonable to believe that while we may have hoped for significant delays or a significantly modified new set of pricing transparency rules, if we take the comments at face value, we will likely see a communication over the next few weeks that align with the President's executive order to move forward with steps to make both pricing and quality data more transparent. And based upon this last text message, it may be more broader than initially proposed. As noted by CMS, our industry's comments did seem to be a key factor with their decision to delay the they really wanted to fully review and vet all the comments. When we were reviewing back on the 27th, which was the deadline for the comment period, there were just over 1,000 comments posted. And at that time, mostly being in favor of the requirement. But between 9/27 and 10/4, that number increased to nearly 4,000. With healthcare providers, about 1,400, as Seema noted, including comments towards the very end of the comment period. So healthcare providers did a terrific job of communicating concerns. And often in those comment communications, there were very specific suggestions, such as exempting those that had already deployed a self-service estimate tool. Now, one of the more common noted concerns from our industry was the requirement to provide the negotiated charge, which is new, it's very confusing, and potentially requires substantial work to create and maintain something that we've never really looked at or thought of in the past. In the draft rules, there was very little guidance with how to actually create such a value when, as we know, reimbursement is at a claim level and it has to somehow be allocated down to the detailed charge level. So we'll know very shortly if our efforts really force CMS to significantly change the draft rules or move them to incorporate some additional requirements, such as a mandate for automating online self-service estimate tools. And as I previously mentioned, this was a common recommendation from our industry, starting with AHA all the way down to many of the written comments, was that reference to what consumers really need is an online self-service estimate tool. So what we do know today is that CMS delayed the final rules, but they did not cancel them. Updated rules are forthcoming, and they will likely be challenged in court by the American Hospital Association and others. But as with the site-neutral reimbursement change, the thought of a lawsuit or even initially losing a lawsuit will not likely deter the administration's push towards greater pricing transparency. And it's not just healthcare pricing, but the administration and CMS are really pushing for greater pricing transparency and quality data transparency. And the same thing carries over into the pharmacy pricing area as well. If we think about it, beyond our industry, transparency as an overall theme is something that really seems to be picking up momentum, with other industries and companies facing similar scrutiny, such as Facebook, Google, Amazon, and other technology companies that are using data without full disclosure. I think the larger question at this point is really, do you believe pricing transparency is needed, and will it happen at your organization? So at this point, we view it as every hospital having a binary decision to make. Is it going to happen or not, and how are we going to respond? So CMS appears to be very committed to pushing something forward and is using this pause to really put forth an updated plan. And our session is really going to focus on how to best use this interim time as things move forward. So if your organization believes price transparency is a larger trend that's occurring and consumers are going to want to take cost into consideration for certain services, not all, but at least scheduled services, we're suggesting specific tactical steps or tasks that you should be considering and doing at this particular point. But to really win going forward with price transparency, you're going to have to adapt. You're going to have to be more strategic. You're going to have a plan that you work and are willing to update as you go forward. So I want to start with highlighting some key steps that your organization should be taking now. And our list of 6 steps is based upon some material provided by HFMA. And following the webinar, Brad will send out this slide deck along with HFMA's list of 5 to-do items. Now, number 1 is having a team that's focused on this issue. And as a baseline, most organizations should have a pricing transparency team in place. It's just a general extension from last year's effort. Core group team members should include the CFO, patient access, who often receives the frontline consumer questions, managed care, who has and manages all of your payer contracts, compliance, with this being a new potential regulatory area with specific fines and repercussions, marketing, with this obviously being a consumer-facing component, and the back office revenue cycle team. Point 2 is to really think about your shoppable items. The market is changing, and we need to be adapting and listening to what services consumers are asking about. Not all healthcare services are shoppable, but services that are scheduled would be a great place to start. And you should really kind of zero in on those areas that your frontline staff is getting questions around. Now, point 3 would be really doing an internal evaluation of your website and the page location for your pricing information. In the draft rules, CMS was very specific with accessibility to the information. and proposed requirements. Going forward, information cannot be hidden, can't be buried on the website, but it's got to be displayed prominently, and the information should be clear and concise. And organizations, in some instances, are actually incorporating community focus groups to really help in this evaluation process. Definitely something that we would be recommending. If you haven't done this as a step, you definitely should be looking at bringing in some of your community patients, individuals to help in that evaluation process. Now, step 4, or point 4, is the fact that your focus shouldn't be solely about price alone. The pricing transparency mandate and the draft rules are also inclusive of quality data. And as we know, price plus quality equals value. So make sure that you're incorporating the relevant quality data in your process. With point 5, consider the frontline staff education and really education across your organization. The letter submitted to CMS during the comment period, it really highlights the fact that it is a complicated process. Consumers have noted it's complicated, we noted it was complicated, and everyone wants to understand and move to a better, more concise, and an easily understood pricing process. So it just can't end here. It's going to have to be an ongoing process. We're going to have to be proactive in our organizations to make sure that everyone from the top all the way down through the organization is aware and well informed. And this includes your board, department leaders, and all staff. A good place to incorporate messaging would be your internal hospital newsletter, as an example. It's also important to go ahead and be proactive with your local media. Your marketing team likely has already met with them earlier this year and probably continues to do so. But it's important to remember, don't wait for the local media to print a story and have to react. Go ahead and be proactive with your messaging now. Also be proactive with your patient communication. And as I mentioned earlier, that's going to start with your website and your frontline staff. The need for pricing transparency is of our own making. And today, analytics and tools can address the complexity and really help you provide a more clear, concise, and accurate estimate for your consumer. And we need to be looking at all of those steps. So as you're going through that process, thinking about how do we provide a more accurate estimate to consumers, we should be looking at our current calculation tools, including contract management and your patient estimation process. As we go forward with pricing transparency, automation is going to be key. With increased pricing transparency, data from your CDM, your payer contract calculations, your estimates, what's posted on your website, are all going to have to be moved to align to a more singular process. You're not going to be able to maintain multiple different automated or even manual processes. That alignment and automation is going to be critical as we go forward. Logical price changes as we start to think about lowering some charges is going to have to really be modeled through all of your processes. Your pricing, both retail pricing or charges, as well as your discount or negotiated charges, are going to need to be defendable. And to be defendable, it has to be explainable. So if you decide your organization needs to continue moving towards these mandated principles, I think it's important to review a few items that are in the draft rules that were really not controversial. They're probably a good baseline point to be working on today to ensure that you're hitting the 1/1 target date that CMS had originally outlined. And it's also important to remember, based upon the 1/1/2019 requirement, we will be having to update our CDM files annually. So we at least need to be looking at that a lot further.
Yeah, and in addition to that, Greg, CMS provided additional guidance with where and how this information needs to be available. And like you said, this builds on last year's rules and the FAQs that they put out leading up to this year's mandate. CMS was very specific with the following. It cannot be hidden or buried on your website, but needs to be displayed in a prominent location. It also can't have various requirements to get to the data. So things like barriers with entering name and email address, and it needs to be easily found and easily accessed. So regardless of how things play out with the final rules, with lawsuits, things like that, everyone today is pretty resolved with the fact that the Affordable Care Act required posting a list of standard charge items. Earlier this year, most hospitals posted their standard price list of items and services with a file that had the bare minimum data elements, that CDM file with the code description and corresponding charge rate. Now in the draft rules, CMS provided additional guidance to really put the patient first by making that data useful and comparable. So additional required items now include things like the code, the description, the corresponding HCPCS and/or CPT code, the corresponding revenue code, and other relevant information such as the NDC code or the modifier. And specific to multi-facility organizations, those prices need to be facility specific. CMS's reference to having the DRG code linked to the CDM file and the negotiated charge for all contracted payers and plans are definitely now more questionable items. These two items will likely be addressed in the final rule, but the additional detailed CDM information should already be queued up with your internal staff. Now, the second file requirement that we're going to talk about from the draft rules was the development of a list of shoppable items. CMS defines shoppable services as a service package that can be scheduled in advance. Regardless of whether this is a final requirement or if it's incorporated into a future mandate for a self-service estimation tool, understanding your shoppable services and the comparative allowable values is really a critical task. Now remember CMS's comments. CMS received over 1,400 stakeholder comments that were thought-provoking and innovative ideas during the comment period. They're working to finalize the hospital price transparency rules alongside a comprehensive proposal for health plan pricing transparency. So if you do not want your services to be seen or negotiated as a commodity, you have to be organized in advance and have a plan to present your price, especially for those shoppable services. To create this file, the first step is going to be analyzing your historical billing data to determine an ideal claim or patient scenario for everything that you do. Then determine based on those services which shoppable items to post. Remember, consumers want to understand. Most of the comments for a delay related to it being overcomplicated, which I think we can agree that it is, but that doesn't mean that we're going to get a pass on this forever. Now's the time to start analyzing this data. Determine where and how you can get this information. Your patient estimation system, your contract management platform, and your decision support tool are possible options to start. Now, as Greg talked about earlier, integrated platforms to manage this new process is really going to elevate the need for an integrated process.
Absolutely, Brad. And as you identify your shoppable services, you need to consider the identification of ideal patient scenarios and the related detailed charges that make up that account. We may or may not be required to allocate down to a negotiated charge, but it is important to understand your organization's shoppable services. Fee schedules for lab, radiology are easy, but an expanded analysis of key inpatient or outpatient surgical services is going to be needed. A good place to start is the list of 70 shoppable items that CMS published. Now, CMS previously stated that 300 shoppable items was going to be a good place to start. And as I mentioned Florida earlier in the ASC note, Florida's comparative data set will have 240. So regardless of the exact number, I think it's important for us to use this time period to continue to analyze and determine each hospital's list of shoppable items for both charge rate analysis in the market, payer contractual reimbursement analysis, and how you may be viewed in the market if you have to publish this information. It's important to recognize key processes that operate as organizational silos are really going to need to come together and work in a more coordinated, aligned fashion. Not just reporting to the same executive, but actually operating as an integrated platform. An accurate allowable is really the connecting component, if you will. That's exactly where PMMC as an organization excels. Payer scorecards, financial reporting are going to have to integrate to really understand not just denials and contractual short pays, but how are collections with the patient, and how do we take that into consideration when we negotiate the contract with the payer and monitor actual reimbursement to projected reimbursement? And how do we adjust charges and reimbursement as the market, in other words, being the consumers, the payers, the advocacy groups, we have to really understand how we compare to others in the future as pricing transparency becomes real. So to really win going forward with pricing transparency, you have to adapt, you have to be strategic, and you're going to have the right tools and integrated processes. Now, the delay has occurred to really bring together a better pricing transparency solution. And as we've noted a couple of times, it should not be seen as a waiver forever. Pricing transparency started years ago with the concept that consumers needed to be more engaged in their medical decision-making process. The Affordable Care Act really kind of built on that basic concept. And the President's executive order earlier this year in June is really forcing this issue to the forefront today. Now, the final rule will be out soon enough, and obviously based upon Ms. Verma's comment, the hospital pricing transparency rule will likely be addressed in a broader context with the health plan pricing transparency. So the goal, I think if we look at this through CMS's eyes, is to really make pricing and quality data more accessible and more insightful for consumers. So what we outlined today are specific steps or tasks that you must do to be compliant. But to really win going forward with pricing transparency, you have to adapt, you have to be strategic, you have to have a plan that you work, and you're willing to update that plan as you go forward. Now, PMMC can support your organization with both strategic steps as well as tactical steps. And we recommend defining first what pricing transparency means to your organization and having a strategy that supports that directive so that all related departments should be aligned from the executive team down. Now, PMMC can also help clients meet the mandate by creating the 2 currently outlined files, as well as helping organizations manage this process going forward with really capturing new market data to improve your understanding of your price position in your marketplace. We've communicated to CMS as an industry that it's better not to have competitive pricing data through the comment period. But if this competitive pricing data, being both the gross charge and the negotiating charge, becomes public, it's going to be wise to really understand how to evaluate and leverage this new data going forward. Now, finally, all sides, being CMS, providers, and payers, have consistently stated what patients and consumers really need is a true, easy to use, easy to understand patient estimate platform. And that's another area that PMMC can deliver through its integrated pricing, transparency, and contractual accuracy application. So as your organization is moving forward, I hope you'll be able to take these baseline tactical steps to continue preparing for what CMS seems to be moving towards the 1/1 target date. Obviously, we will be putting out more information as updated rules are posted. But at this point, Brad, do we have any questions from the attendees?
Yeah, I'm going to take a look here and see if we have any questions. And if anybody does think of anything they want to ask either myself or Greg, go ahead and enter that in the questions tab. We'll stay about 5 minutes or so past time and take any questions that anybody has. Greg, I know one that is probably on the top of everyone's mind. Do you believe that if the final rule is published before the end of the year, do you think that they'll stick to that January 1st deadline?
What we've received from CMS's pricing transparency team in way of communication is that at this point, January 1st, 2020 is still the target date unless they publish something counter to that. And so we're still going off of everything CMS has communicated, not what we or others would hope or like to see. But currently CMS appears to continue to be moving towards that 1/1 date. Hopefully it will be pushed, but currently that is the target date that they have out there.
That sounds good. And another question that I have, Greg, for you is, where do you see self-service estimates playing into this whole scenario? Do you think that could be a mandate, a future mandate potentially? Is that something that could be wrapped into this one? What are your thoughts on that?
I think based upon our industry's responses from, and really looking at the American Hospital Association down through all the comments, there was one piece that was very consistent, and that was our industry needs to provide to consumers what they really need to know, and that is what their anticipated out-of-pocket expense is going to be through a self-service shoppable platform. So I think the next step, if it's not in the upcoming mandate final rules, I think we should all be prepared for another executive order or potential future mandate that will be requiring all hospitals to have on their website, just like all payers being required to have on their website, a tool for patients to be able to go online and shop and compare prices, being the patient out-of-pocket price. That's going to be a key component, because we have been saying that's what the industry really needs. It will likely become a mandate that will be required of our industry.
Yeah, I agree. I think that lines up with CMS's goals and aligns with a lot of the comments that they received on this mandate. I do have another one from the audience here, specific to the proposed rule. Where in the CMS final rule for the January 1 mandate did it state that codes need to be included as well as the description?
As a follow-up, Brad, we can send out the actual page, the language from the draft rules with that information.
That sounds
good. In the rule, it was around, I think, page 630, 634, that range. But we can get that out to all the attendees.
Okay. Yeah, we'll send that out to the group ending this afternoon. Well, I don't see any further questions from the audience. Greg, did you have any closing thoughts before we wrap up today?
Not really, other than this is continuing to evolve. Obviously, we do anticipate CMS putting out an update likely over the next couple of weeks. We have tried to be very optimistic that this may be something that will be delayed. It will be something that CMS will back off of. But I think at this particular point, most organizations do need to be prepared for something very close to the current draft rules being part of the final mandate rules as we go forward. Our team's available to help in that process, both in providing the baseline data that you need to be in compliant to just meet the requirements, as well as our ability to help you manage and really use and leverage this data as we go forward to be sure that the data is going to allow you to make better decisions in your contracting and negotiation process. So we do appreciate everyone's attendance. If you have any direct questions or would like to schedule a strategy session with one of our team members, feel free to reach out to either myself, Tara, or Brad, and we would be glad to schedule a call to have a follow-up one-on-one with you.
Thanks, Greg. And just a closing thought, we will be sending out the slides, and we also recorded today's session, so that will be sent out to everyone in the audience by tomorrow. So thank you, everyone, for attending this afternoon. Greg, thank you again. And we will, I'm sure, be updating everyone here shortly once we hear about the final rule. Thank you again.